So I would like to talk about care and maintenance of the hybrid fixed prosthetic. So here I have a model of a standard hybrid fixed prosthetic being supported by 4 implants. And care and maintenance is very important, just like it is for anything else, for the longevity of the prosthetic and also the health of the implants that are supporting it. So here I have a few items here. I have Oral B Super Floss, which I think is a great product for this particular application. I'll show you why. And I also have regular floss here, just regular reach or any kind of glide dental floss will work with floss threaders. And a floss threader looks something like this. So it's pretty much like this. And first I'll talk about the Super Floss. Super Floss is, you can find it in any hard drugstore, and it's in the dental section where you find toothbrushes and toothpaste and whatnot. But it has a stiff end here, so that's the side that you're going to use to send through between the prosthetic and the gum. It has a spongy side here, so if you have larger gaps and wider spaces, you can sort of use this spongy area to get into the spaces that you need to, and just an area of just regular floss as well. So it has both the spongy side and regular floss. So what you're going to do is you're going to need to really kind of get up above your lip and where the junction of the prosthetic and the gum is. And usually I find that the easiest way to find enough space in between is typically right where the implants are. So in this particular case, if I go right next to the implant, I can usually find enough room to send the stiff end of the Super Floss through. And what you're going to do is you're going to kind of catch that on the other side. So if it's on the lower jaw, it's going to be on the tongue side. On the upper jaw, it's going to be on the palate side. And once you get that other side, you're going to pull it through. And if I'm just going to use the spongy side, I'm just going to use that to go back and forth over the prosthetic to kind of keep that clean. Now, the prosthetics should be, and usually they are, very smooth, almost like glass. So they don't collect a lot of plaque, but they definitely will collect plaque and hold on to it if you're not getting in there and cleaning in this manner. So going back and forth over the prosthetic, and then if you want to just use a regular floss, you can do that too. You're just going to send it a little bit further through, get to the regular floss, and again in a similar fashion go back and forth over the prosthetic. And then when you're done, you're going to either pull through on the palate side, or you can even just pull through on the lip side right here and pull it right out, okay? And then you're going to want to do that again between the other 2 implants. So if you find 2 other implants there, and again you're going to want to go into the area that has where the implant is, right adjacent to the implant, and you're going to send that floss through, and you're going to pull it through the other end, and you're going to do the same thing back and forth, okay, in a similar fashion, back and forth, okay? And then the easy part is getting all the way in the back. Once you pull that through, you can either go through with regular floss, but all you have to really do is hook the back of the prosthetic and pull it over, and then just kind of go back and forth until you keep that clean. So there should be enough room in order to do that. Usually it's less than 1 millimeter, but it should be sufficient room to do that. Okay. If you don't have Super Floss, and if you have regular floss, you can use a floss threader, okay? And the floss threader is just a stiff part. It's kind of like the stiff part of the Super Floss. And all you're gonna really do in this case is take a regular floss, whether I'm using Reach by Reach Minted Wax, but you can use Glide if you want, or any other brand, and kind of send that through the loop, okay, to about halfway, okay? And kind of fold it over itself, and that gives it some thickness too, which you might like in order to really kind of debride the area, get as much debris out of there as possible. And again, in this case, you're going to just send that thick side through near the implant is where I find it to be easiest to get into there. Pull it out on the palate or on the tongue side, okay, best you can. If you have like a pair of tweezers, sometimes people use those to kind of pull the other side out. But now that the floss is through, in a similar fashion, you're just going to kind of rub back and forth, just kind of keep the the surface of the prosthetic clean. And then once you're done, you're just gonna pull it right through, okay? Or you can pull it out the other way, just like we did with the Superfloss. And the other part that you're gonna wanna not forget is you're also gonna need to brush the prosthetic. Okay, so a couple of times a day we should be adequate with that. And that's how you perform the daily maintenance of your hybrid prosthetic.